Hello, it's mid-May of 2016. I make this video for those of you out there who are also going to be having a vitrectomy operation. In my left eye, it's like looking through a smoked glass, basically. As a result of having an aneurysm, subarachnoid hemorrhage, blood was forced into the eye cavity. Now, for the last couple of days, I've been taking and getting ready for it the solution called Ocuflox. It's an antibiotic, 4 drops a day. It hasn't been stinging at all, so that's been good. So what will be happening today through Dr. Rajeev Muni at St. Mike's Hospital in Toronto, the vitreous humor liquid within my eye will be drained. From what I understand, it will be replaced with another solution to allow light to come through the eye and actually get to the macula and the retina, so I should be able to regain, apparently, as this document says, within 2 to 8 weeks get my former vision back. So I'll be leaving shortly for the hospital, and I'll get back to you with the results of how that all works out. I'm home from the hospital after having the vitrectomy for the hemorrhage in my left eye. The situation is that I have very little pain now. It's almost non-existent. The operation itself only took about 10 minutes. Prior to going into the operation, they put an IV into my hand to give me some solution before going in. They put drops in my eyes 3 times, separated by about 5 to 10 minutes. The first one was the Ocuflox, which was an antibiotic. Next one is a midrifin, which is it constricts the blood vessels in the eye and dilates the pupil. And the third one was, I think it's Psychage, proper name cyclopentolate. It relaxes the sphincter of the iris and the ancillary muscles, I guess. They did an air fluid exchange as well with my eye. So I have to admit it was not so bad at all. The people were nice, and the operation very quick. So I've only been home about 10 minutes. They said possibly to expect some pain. I have to return to the doctor's office tomorrow morning, at which time they will take the patch off and he will have a look inside the eye to see what's there. And apparently I have a hard plastic cover that I will be putting back on and off myself and taking some additional eye drops as we move along. I will talk about those at the next viewing. It's 3 hours after the surgery and I can start to feel the pain. It seems to be centered right behind the center of my eyeball. I've taken 2 Tylenol as instructed by the doctor. It's 6 hours since the surgery. I mentioned I had a little pain earlier. I took 2 Tylenol extra strengths. I have no pain right now. I'm about to go to bed and keep my head elevated as per the doctor's instructions, and I've been instructed to come see him again for a checkup tomorrow morning. So I will report upon my return as to the outcome of what he sees from his handiwork. It's the next morning after the vitrectomy. I have little pain. I'm just getting ready to go to the doctor to have the patch removed so that he can look at his handiwork. I've come home from the day after surgery. I've gone to see the surgeon this morning. First thing I got there, the technician told me to take the eye patch off that you saw in the video. That wasn't too bad. It was easy to do. The eye was eyelid was shut a bit with some sort of crusty stuff on the eyelid, but I was able to pull it off, so it wasn't too bad. The eye was very red. I've taken a picture. Perhaps you can see it a little bit here. So when I look through it, it's like looking through a half-filled glass of water. I can see the line of where the level of the water is. There was an air bubble put into the eye, the surgeon said. It helps enhance the healing of it, and it should take about 2 weeks to dissipate and fill up normally. I've been told to take some antibiotic. It's called Ocuflox, so I take 1 drop 4 times a day. I'll be taking a prednisolone acetate, 1 drop 4 times per day, and atropine, 1 drop 2 times per day. I'm not suffering from any pain. You can certainly feel that something has happened to the eye, but it's not painful at all. I would have to say, all in all, it seems like a good operation took place. The doctor seems happy with his work, and he's told me to come back in 1 week. It's the second morning after the vitrectomy. I slept fairly well last night. There's very little pain, hardly any at all, so I'm very happy about that. The level of fluid in the eye seems to have gone down as well. I'm grading it by taking my finger and putting it towards the top of the level of fluid in the eye, and of course using my nose as the gauge from day to day. I can read a few things up in the top of the eye where the fluid is not, whereas I couldn't do that previous to having the vitrectomy. The blood in the eye certainly clouded it, and I could see very little other than light. So all in all, I'd have to say it's coming along very well. It's about 72 hours after the operation. The level of fluid in my eye seems to have gone down a bit. As I said before, I used the top of my finger to the top of the level. It seems to be going down, so I can start to see out of the top of my eye now, although it's a little cloudy, but it's certainly far superior as to what it was before when the blood was still in my eye. Had a good night's sleep last night. Very little pain. It's just a little discomfort, that's all. I wouldn't call it pain, not compared to what I've experienced in the past. So all is good. Looking forward to it getting all better. It's 96 hours after the operation. And the fluid level in my eye, now it's down to about here, as I can see, so it continues to go lower. I had a restful evening last night. I slept well. There is no pain. It's a little itchy at times, irritating, but no real pain. It's 5 days since the surgery. I woke up this morning with definite better vision in the left eye that it had happened. Looking at it, it looks like the redness is starting to dissipate somewhat. I still have the liquid in my eye, and I guess it's down to about there when I use the finger technique that I've been showing you. Still wave my head and I can still see it swish around down the bottom. A little bit of deviation in the eyesight. Little light spots sort of thing, but I think they're clearing up. Yesterday I had some vertical striations that seem to have been clearing up, so all in all, seems to be going better. So 5 days after, I feel confident that the left eye vision is coming back to where it was. I'm able to look at a computer again, of course with my cheaters on, and read everything with it now, whereas before I had no vision. I was unable to see make out any words or anything. I could see the light, I could see there were shapes, but now I can see there's words and actually read them in a very small 10-point font. 6 days since the surgery and all is going well. It seems that the white spot is starting to form around the eye. The red is dissipating. I have no pain. I have only a small fluid bubble. I can see at the very bottom of my eye. For the most part, the eyesight has come back where before I could not see. It was like looking through a pane of smoked glass. So you can see the light, maybe see the movement of a hand in front of you. Just something moving, but whereas it's come back, there's a little bit of fuzziness, a few spots in the front, but they seem to be dissipating as well. It's 1 week since the operation. Still no pain. I go for my checkup tomorrow with the surgeon. I'm expecting good results. I'm hoping that what I've been experiencing has been a good result. You can see some of the white of my eye coming back as well. The fluid bubble is in the very bottom of my eye now, very small. I suspect other things will happen, of which he'll tell me tomorrow. I've just come back from my 1 week, 1 day checkup with the doctor. He seems happy with the progress. Still small bubble of fluid in my left eye. He says that'll dissipate over the coming days and fill up with other fluid created by your body. I've been told to stop taking the Ocuflox and the atropine and stick with 1 drop 3 times a day of the prednisolone. And of course he gave me a couple of new prescriptions as well due to an increased pressure in the operated eye. They are Combigan and Azopt, of which I will take let's say instill 1 drop in the left eye twice a day. Same for both of them. No pain. The eye is clearing up quite nicely, I think. So it's amazing what modern medicine will do. I'm very pleased with the eyesight, and I look forward to it getting even better from here on.